Hi, everybody. Suzanne Barnhurst here with week five's brief lecture on a couple of things, starting with the group project. I just want to give you a couple of points about the group project so that you're not in a panic this week. It is due Wednesday. That's to give me some time so that I can comment on it during this week and into the beginning of next week. Since the final part of it is due in a couple of weeks, I want to get to it as quickly as possible. I want to review it and look for things that might be missing, or look for content that has, where you might have some missing pieces. I'm not looking for spelling or the PowerPoint itself and whether or not it's perfect. This is a draft, a rough draft, but I want to see the content for part one of the group project. So that means no resources, no title page, none of that, just the meat of part one. If you have any questions, please have somebody text me or call me so I can answer your questions before then. Look for my comments in the written discussion board, which is in the left tab in the navigation bar. I'll put there'll be a discussion in there entitled Group Project Comments, Group Project Part 1 Comments. When you post it, everyone, all five of you must put it in your Dropbox for part one for the purposes of grading, okay? Again, it's a rough draft, but make sure everybody puts the same one in the Dropbox. Okay, so that's what I wanted to say about the group project. Quickly, I'd like to say a few things about the case study. You did a very good job with the case study. I just want to review a few points that I saw. Some of you did get, some of you didn't, and I just want to review them quickly so that I think it'll help you for the final group project and hopefully help provide you with a little more understanding of this idea of organizational culture and customer perceived value. So let me just give you a list of things I see that Tom and the upper management and to some extent Yolanda missed for this in this case. First thing they did was they missed revisiting the strategic plan. How was it working? Where were the problems? Were there any new opportunities? Since they only had a year to go, they probably were pretty familiar with it, but they didn't seem to identify other issues. Did they do a survey of the patients, and did they do a survey of the staff before they decided to go to television advertising? The case doesn't say anything about that, and probably that was the beginning of the downfall here. Another thing that they missed was when Tom went to the let me back up. Another thing they missed was Tom made a what do I say here? He made what I call a cowboy decision and did it without really discussing it, and went out and hired this outside firm, when clearly in the past they hadn't used an outside firm. So not only did they miss speaking with the patients, they sort of ignored that and just hired this outside firm. Yolanda, when she saw what the outside firm brought back, had a gut feeling about it, but she didn't take any action. She didn't say anything. Maybe because in the past when she said something, they told her, no, don't worry about it. And so she didn't feel comfortable. However, she did have a gut feeling. And in business, once you've been doing it for a while and you've seen things in the past, you have experience, you will have those intuitive feelings where you think, wait, this isn't right. And then what she should have done was step back and say, okay, what did we do before and what are we missing? And that's what she was saying. We're missing something, but she didn't know what it was. So she needed to go further with that. They also missed the organizational culture. The culture clearly of the past was warm brownies. How many practices or places have you worked where that's the kind of culture, where the patients are happy because the staff is so nice, because they're so happy? They bring brownies for the patients. They bring them for each other. They probably celebrate everybody's birthdays. They probably have a Christmas party, a picnic in the summer. They were that kind of group. So they didn't involve the staff, and they didn't involve the staff to talk about it out loud when they went out and got this outside agency. We don't know who that outside agency was. They could have been really maybe an outside agency that usually does much bigger healthcare organizations, which would have been inappropriate for this practice anyway. Even though it was 30 physicians, it still wasn't a big hospital. And they didn't really speak with the staff about it. So the staff was very surprised, taken by surprise, just like the other case we looked at about the medication. And one other big thing that they missed was the customer perceived value. We know that the marketing concept and marketing orientation of an organization, which is where we're headed today in healthcare, focuses on the customer. And the customer in this case is the patient and their families. And they have a perceived value of what they get out of that practice. And if they would have stopped and asked those folks that, they would have known that going outside for an outside marketing firm to do advertising wasn't what those patients wanted. Now, if they saw a huge decline in that type of patient, maybe they were all older, maybe they were more traditional and liked things to stay the way they are, and they wanted to move forward and attract a younger population, that would be one thing, but that wasn't stated in the case. So they missed a lot of things here that they could have done better. And one thing that text doesn't say is why they even decided to go for TV commercials. It's a big practice, but it's clearly a regional, local practice, and it's not necessarily, television commercials are not target specific. They're more of a mass marketing. So everyone who happens to turn on that channel sees this commercial. And clearly it wasn't received well by current patients. So they missed the mark on the target market. And there's a lot of other ways they could promote themselves within the community, which is where most people go to their physicians. They want to go somewhere close. They don't want to travel 45 minutes to an hour just for a family practice doc. So there's a lot of important things, a lot of things here that should have been done differently. As far as the paper organization, all of you did very well. In papers like that have to be an APA format. They need a title page. They need a resource page. And they need that specific format that APA calls for. And also the citations should be in APA 7th edition. Citations within the text are done a particular way, and resources are written in a particular way. If you have questions about that, we do have a writing center. The person's name is Greg. I can't think of his last name. I did put it in the syllabus, and it's also, I think, on the reflection paper that's coming up, his contact information. But if you call the help desk, they'll be able to give it to you also. And I think you can access it in your navigation tab. Okay, so that's the group project and last week's case study. And briefly, I want to talk about chapters 9 and 10. And I say briefly, I mean very briefly. I don't want to do a lecture on that because it's extremely dry information. However, it's very important that you understand our health insurance structure in this country, because it dictates how we access, how we receive, how we access, where we go, what we pay, and who we see many times. So the text has a good chapter on that, and it's very well organized. It gives you a little bit of a background about how insurance evolved. And when I say a little bit, it's really a little bit, because there's a lot more interesting information about health insurance out there. But I'm just going to go over a few of the things that I want you to focus on. The first one is who pays. And that's relatively quickly in the beginning of the chapter. And it talks about the types of insurance, starting with private insurance. Private insurance is usually what you get when you work for an employer. You can also buy private insurance individually, but it's extremely expensive. But private insurance is usually what you get through an employer. Sometimes you get it if you're a board member or something like that. But the four types that they talk about are HMOs, PPOs, point of service, and high deductible plans. If you go to page 198, there's a very good chart comparing the four of them and how they differ in regards to how they pay, what they pay for, that sort of thing. So private is one type. The next type of insurance is social here in this country. And we have several types of social insurance. That includes Social Security and Medicare. It includes the Medicare prescription drug plan. It also includes the Affordable Care Act of 2010. Under those things, we have Medicare, which is for folks over 65 or people that are permanently disabled at a younger age. And that includes even kids, 5, 10 years old, who may have had some sort of this terrible accident or be born permanently disabled. They also qualify for that insurance. That's Medicare. Medicaid is for the medically indigent in this country. They make under a certain income level, considered below the poverty level. Then we have CHIP, which is we call that, it's a children's children's health insurance policy. And that's for low-income families, children of low-income families who just don't qualify for Medicaid. They make just a little more than they can, qualify for Medicaid. So they have CHIP, which makes sure that kids get not only health insurance, but dental insurance and any kind of emergency insurance. And then there's also insurance for vets, and I don't know why I put vets and veterans, but it's insurance for veterans that they get either after they come out of service or when they retire from service. They can get it for their entire life. So even if they serve 3 years, they can get this insurance. There's another section in the text that lists the statistics and the costs and who has insurance. Let's see, let me tell you where that is, because that's a very interesting piece of information. It's on page 213, and it lists a statistic about health insurance coverage in numbers of who has it and who does not. And then the next thing that I really want you to look at is on page 215, which are those that are not covered and the uninsured. We still have, according to this, by 2013, we had 13% of the population that still wasn't insured, and that's after the Affordable Care Act of 2010 was enacted. So we've decreased that since then, probably to 12% or so, but we still have a good piece of our population that doesn't have health insurance. So as you're doing this group project, you were asked to look at the community health needs assessment from Lehigh Valley Hospital, and you'll see where they identified needs or gaps in services. And this population is part of that, as well as the population on Medicaid and the children on CHIP. They're also part of that population. Everything they do hinges on how they're going to get paid or where they're going to get the funding from. So there are going to be times when they're not going to get paid by social insurance or private or out of people's pocket. So they're going to need to raise funds another way. And this information on those that are uninsured, it will help you to identify those folks. And then chapter 10 is on managing costs and revenue. As a manager in a hospital before, not being a finance person, I depended on the accounting department to help me with that. And most managers do. That's why hospitals and healthcare systems have accounting departments to help them. But the manager's role in this is to develop and monitor a budget and provide input into the spending of their particular department, what they see that they're going to need, what they need that they don't have, and any kind of impact these issues will have on revenue and costs. So it's an interesting chapter. I don't need you to dwell on it unless you're really interested in the accounting pieces, but you need to know as a manager's perspective what your responsibilities are. Okay, so any questions about the group project? Since it's Monday, I need you to text me and let me know that you have a question. We can either talk or you can tell me you sent me an email, either one. If you have any issues getting the project done by Wednesday night, let me know. You also have a discussion forum this week, and those posts are due by Thursday. But since we have the group project in the middle, if you don't get it there by Friday, that's okay. So I hope you have a good week, and I will be looking forward to the beginning of this group project. Thank you very much.